Hello, I am Dr. Paul Byrne. This presentation is about brain death and organ transplantation. I am a pediatrician and a neonatologist who has studied these issues for more than 30 years. It's my pleasure to be able to share some of what I have learned with you today. Recent news reports of responses of persons declared brain dead should have alerted everyone that brain death is not true death. These observed responses prevented organ transplantations from going forward. Zach Dunlap later reported that he heard discussions of his death but could not respond. Val Thomas had flat brainwaves for 17 hours before her response was observed. And there's another man from France who also was on the verge of having his organs taken when he was able to show some response that saved his life. Such cases ought to be of grave concern to every citizen, not only of the United States, but also of the entire world. This presentation is about the 3 R's. The 3 R's are rights. There are unalienable rights to life, liberty, and the pursuit of happiness. Rulings that are done sometimes by judges, but oftentimes by legislators that do things to make it such that you are unable to protect and preserve your own life or anyone else's life anymore. There are responsibilities, and we have responsibilities to take care of ourselves and to take care of others who are around us. This is a picture of Joseph in 1975. Joseph was born very prematurely. He was on a ventilator for several weeks and not responding when a brainwave test was done. The brainwave test was reported as consistent with cerebral death. At that time, we did not do anything to hasten his death or to impose death on him, but we continued to treat him. Joseph eventually got off the ventilator, went home. This is a picture of Joseph when he was about 7 years old. When Joseph went to school, he got straight A's, ran track, and played baseball. Here's a picture of Joseph with his wife and 2 children, and they have another child since then. Joseph is a paramedic. This is a picture of Brandon. This picture was taken when Brandon was about 16 years old. He had an accident that involved his head. This is a picture of Brandon with his brother and his sister and his mother and father. Brandon was taken to the hospital at the time of his accident. In just a few hours after the accident, his family was told that he was brain dead and that they should go home. His family had feelings that Brandon was still there. They wanted to go back to the hospital but did not, stayed at home, only to find out later that Brandon was still at the hospital because they did not take his organs until about 18 hours later. During that time, Brandon was in the hospital and very much alive, just as the family suspected. But by the time they found out any further information about Brandon, already his beating heart had been taken from him. Now, it would be one thing if Brandon lost his life, and that would be very serious. But what happens when somebody's life is taken from them, it isn't just that Brandon is no longer here, but also since that time his sister has married and has children, his brother has married and have children, his grandparents are still there, his mother and father, and they all miss Brandon greatly. But you know something? We all miss Brandon also, because he's not here to do the many good things that he could have done, not only for himself and his family, but for all of us. At the time of the Declaration of Independence on July the 4th, 1776, one of the bases that is recorded there is that it is about people, the separate and equal station to which the laws of nature and nature's God entitles them. In modern language, we use natural law and natural moral law to express these terms. They go on to say these truths are self-evident, that all men are created equally, endowed with certain unalienable rights, the rights to life, liberty, and the pursuit of happiness. Life is our existence. Liberty is a special word, comes from the joining of two Latin words, liberum arbitrium. The liberum, the first part, has to do with desires. The desires, then we can act on those desires, and what we try to do is to have mastery over desires. The two Latin words are liberum and arbitrium. Liberum is desires, arbitrium is kind of like arbitrary, but can be translated as mastery. And of course, in Latin, oftentimes the order of words is reversed from what we're used to in English. So liberty comes from liberum arbitrium, which can be translated as mastery over desires. That means to do good and avoid evil. And of course, if you do good and avoid evil, what you do is develop your conscience. And then we have our conscience, and really that's where privacy comes from. And oftentimes people get these things mixed up, but there is an unalienable right to life and to liberty, and that unalienable right to liberty is mastery over desires, do good and avoid evil. That's where our conscience is, and that's where privacy comes from. It's the other in the other right is the pursuit of happiness. And of course, the pursuit of happiness is not simply having a nice home and automobile and perhaps other things, but it's ultimately to get our eternal reward with our Creator. Now, there is truth in these matters that we're discussing, and mine in the beginning, and still is, a search for the truth. And once we find the truth, then we must hold on to the truth. Once we hold on to the truth, and as we find it, we have to be equipped with the armor necessary to do these things. You can get information about the armor by checking in Ephesians chapter 6, verses 10 to 17. And of course, what we're striving for is to have justice for ourselves and for everyone else. There is a special relationship between God and every person. God creates us male and female. Once we get our life and we're on earth, then what we can do is take care of ourselves, and we then have the privilege of taking care of each other. The person can be defined as an individual substance of a nature rational. This is how Boethius, around 450 A.D., defined the person. The words seem like they make us uncomfortable when we first hear them, but if we just consider them for just a minute and think about the individual has to do with our existence. Each one of us is one. The substance has to do with what we are made of, and we are made in the image of God. And then the nature has to do with how we behave, and of course we ought to be behaving in the likeness of God. And rational is another special gift from God, that we are able to reason and to do good and avoid evil. So the person can be defined as individual substance of a nature rational. Now, each person gets attributes of God. It has to do with our existence. We're living. And then we have a chance to take care of our gifts. That is to protect and preserve our life and our other gifts. And concurrence is another attribute of God. This is a requirement for everything that we do. And then governance has to do with acting on that rationality to do good and avoid evil. The relationship between a physician and a patient is a special relationship. It's based on a standard of intrinsic worth. What the physician, and when I say physician, I do not mean to limit it to just the physician, because it's everyone who's in medicine. It's physician, nurses, respiratory therapists, laboratory technologists, and everyone in medicine. And if we carry it to everyday life, we also see that parents act in this way too, and teachers act in this way. But what is it that's special about the physician-patient relationship? And that is what we can do. What we can do is protect and preserve life. And in so doing, we postpone death. In fact, if anyone would ever ask a doctor or nurse to do something that would not protect and preserve life, the doctor and the nurse ought to get away from it and have nothing to do with it. The life of the living human person is a reality. We can look in a mirror, we can see each other, we can know that we are a living person. Our life is a gift. Once we have our life, it's a continuum from its conception to its natural end. The life is in each cell, tissue, organ, and system. What is a system? It's a group of cells, tissues, and organs to carry out a particular function. There are 11 systems in the human person. There are 3 major vital systems. The major vital systems are the circulatory system and the respiratory system and the central nervous system, with special focus on the brain. There's interdependence of organs and systems to maintain the unity, the oneness of the body, the unity, the oneness of the person. No one organ or system controls all the other organs or systems. Once we have our life, it is manifest. We can see it, we can know it. God creates the person. When God creates the person, the soul, intellect, and will are concreated. At conception, the person is manifest, so that when the zygote is there, we can know that the person is there. Each person is unique and unrepeatable. During our time on earth, there is a unity of the physical and the spiritual. There's a unity of the soul and the body. Life on earth is somewhat like a line that can be drawn on the board. The line has a beginning, and once the life is there, we label that as conception. Early life is spent inside the uterus. There are special events in life. A very special event is birth, and I have the privilege of being there at the time of the birth of many infants. Life on earth is a continuum from its conception until its natural end. Life is not smooth. There are the ups and downs, and there's eventually a time when life ends. We used to call that death, but because of the various adjectives that have been put at, and I call them adjectives or even other nouns to modify it, it makes the word death somewhat confusing. So that if we're going to use words to describe the end of life, we should call it the natural end or the natural death, because once we go from being alive until to being dead, then the word dead and truly dead can be used. To be dead is a negative. It's an absence of the life. It's the state of the body without life. What we have then are the remains. The remains can be described in terms of dissolution, destruction, disintegration, and putrefaction. Yes, it does include non-functioning, but it's more than simply non-functioning. What is left on earth is a dead body, a corpse, the remain. The body is empty. The dead body, the corpse, a cadaver, can be described in terms of cold, stiff. unresponsive to all stimuli. The corpse is not breathing. Even if we would put a corpse on a ventilator, the air can be pushed in, but there is not and will not be any respiration. There's no heartbeat, no pulse, and no blood pressure. The color is poor, it's pale, it's blue. The corpse doesn't move. There's a cessation of all vital body functions. The history of these issues of brain death and organ transplantation began in 1954 when the first kidney transplant occurred. It was the transplantation of a kidney from an identical twin to his identical twin. And there were attempts to transplant other things during those years, but the real challenge was to transplant a heart. The first recorded heart transplant was in 1967 in South Africa. Now, what most people don't know is that 3 days later, a second heart transplant was done in Brooklyn, New York. Both of these transplants were illegal. Both of these transplants were immoral. However, to get around this, a committee was put together known as the Harvard Criteria. The Harvard Criteria published in 1968. The definition of irreversible coma was the title of that publication. In that publication, irreversible coma was transposed into brain death. Coma only occurs in the living, no matter how it's modified. Quickly, the law got involved, and Kansas passed a brain death statute in 1970. The way that the permission is obtained to get organs for transplantation is through the Uniform Anatomical Gift Act. Other things occurred as part of the development of this culture of death. The term persistent vegetative state was first published and coined in 1972. It, like brain death, is not based on any kind of valid science. The Roe v. Wade Supreme Court decision in 1973 made it legal to impose death on the unborn throughout the entire 9 months of pregnancy. This is commonly known as abortion. In 1976, the Karen Ann Quinlan case was occurred. It's known as the index case for the right to die movement. Karen Ann Quinlan was a young lady who overdosed on alcohol and drugs and was on a ventilator. They first went to court on the basis that she was brain dead. They soon concluded that she was not, but they eventually went back to court to get permission to turn off her ventilator. Every doctor who testified in her case said that she could not possibly live even another year, even with the ventilator. Karen Ann Quinlan was taken off the ventilator and lived another 10 years. An autopsy was done on Karen Ann Quinlan, but her brain autopsy was not begun until 3 years after her death, and it was another 6 years until it was published. While she was living, it was said that her major pathology was in her cerebral cortex. The cerebral cortex is the largest part of the brain. Actually, at autopsy, Karen Ann Quinlan's cerebral cortex was fairly normal. Her major pathology was in the thalamus, a very small part of the brain, but in the center of the brain and significant. But it's the kind of thing how these investigations are oftentimes quick and incomplete, and perhaps if her true pathology had been identified, it might have been that she could have been treated differently and perhaps even lived much longer. But in any event, the Karen Ann Quinlan case resulted in her not dying immediately when the ventilator was stopped, but resulted in her continuing to live for another 10 years. In 1980, the Uniform Determination of Death Act was coined, and we will tell a little bit more about this in a few minutes. Also, 1990, the Patient Self-Determination Act was distributed throughout our entire United States. It makes it so that every time you enter a hospital, they ask you if you have a living will. Incidentally, living wills have nothing to do with living. They are somewhat analogous to life insurance. How could anyone sell life insurance if they were called death insurance? Likewise, how could you get someone to even consider a dying will when in fact they call it living wills, but they do little or nothing to protect or preserve the life of the person who executes them. In 2006, the campaign was begun to revise the Uniform Anatomical Gift Act. At this time, 36 states have already adopted the revised Uniform Anatomical Gift Act, and we will tell you a bit more about this in a few minutes. Are the brain-related criteria scientifically valid for true death? Well, even if we're not a scientist, let's consider a few things. The Harvard criteria that I mentioned that was published in 1968 consisted of making the observation of absence of certain brainstem reflexes. That is, the pupil does not respond to the light. The cornea does not respond when it is stimulated. The person does not have a cough or gag and is receiving ventilatory support. That is, the person is on a ventilator. This criteria was published in the Journal of the American Medical Association without any accompanying basic science studies. There were no studies on dogs or cats or any other animal. There was only one reference to the article, and that had nothing to do with any patient data. You have to realize that this came about at a time when people had become dead for literally centuries and centuries and centuries, and they were pronounced dead in a very safe way by doctors, but this was a new way to declare someone as being brain dead, and yet they published it without any basic science studies, no cats, no dogs. They had no patient data. How do you like that for science? The Minnesota criteria was published in 1971. This study was to evaluate whether it was necessary to do brainwave recording before declaring someone brain dead. What they did was study 9 patients. 4 of the 9 still had brainwave activity. Their conclusion then was no longer is it necessary to record brainwave activity. Keep in mind that brainwave activity is thought by some to have the difference between being alive and being dead. Yet, even though 4 of the 9 patients still had brain activity, they concluded that no longer was it necessary to require recording of brainwaves prior to a declaration of brain death. In Great Britain, where they have socialized medicine, they do not do brainwave testing. They evaluate only the brain stem. What's published in the British Medical Journal on February the 14th, 1981, that the doctors in Great Britain were considerably influenced by the doctors in Minnesota who do not use recording of brainwave activity, so they don't either. The largest study in the literature came out of the collaborative study. The collaborative study was eventually a report on 500 patients. 44 of the 500 did not die during the time of the study. Of those that they did an autopsy, 10% had no evidence of pathology in the brain. In 1977, in the Journal of the American Medical Association, a report of this was published. In that report, it states, these criteria are recommended for a larger clinical trial. This larger trial has never been done. It's now more than 30 years later. It will not be done because they are already getting organs. The purpose of brain death was to, in the beginning, get hearts for transplant, to get beating hearts for transplant. It quickly evolved into getting other organs also. Between 1968 and 1978, there were 30 published sets of criteria. All of them were different. All of them became less strict than the previous one. Thus, a person could be declared brain dead by one, but be very much living by the others. This more lenient standard for harvesting organs is what grew out of the brain death criteria. They now call it recovering organs. Some people think that the standards are the same all over, yet when you read the literature, you find out that there are no clearly determined parameters for making this declaration. There are no commonly held criteria by any international scientific community. There's no consensus in the criteria. The most recent report was in Neurology, January 2008, where it clearly states that there's no consensus and agreement amongst the leading neurologists who were surveyed. So far as brainwaves and brainwave testing is concerned, there are many people who think that brain death means flat brainwaves, when in fact many times brainwave testing is not even done, and certainly it is not required to be done. So far as organs and tissue transplantation are concerned, it's important to know that tissues can be obtained from someone who is truly dead. These tissues are skin, bones, corneas, veins, heart valves, and connective tissues. They are tissues not requiring a major amount of blood supply all the time. They can be transplanted into someone, and they do not require anti-rejection drugs because they are fairly inert tissues. The corneas, by the way, which when people talk about eye transplant, what they're really talking about is the transplantation of the front of the eye, which is known as the cornea. God made the cornea without a blood supply, at least without a blood supply where we can see the supply. If we had blood vessels coursing through the cornea, it would be much more difficult for us to see. The cornea does require oxygen, but the oxygen goes from the environment through the tears. So the corneas can be obtained for transplantation several hours after circulation has stopped, several hours after true death has occurred. Organs, on the other hand, must be obtained from someone who is not truly dead. The heart, lungs, kidneys, liver, pancreas, intestine, and other organs come from someone who is not truly dead but has been declared brain dead. This is abbreviated as DBD. These donors are known as heart-beating donors. On the other hand, organs are also obtained from persons who are declared cardiac dead. This is donation by cardiac death and is abbreviated as DCD. These people have a functioning brain. They clearly have a functioning brain by everybody and anybody's criteria, but there's still a desire to get their organs. So what occurs is that they get a do not resuscitate order, the ventilator is then stopped, and then they wait until the person is without a pulse. Not until they're without a heartbeat, but until they're without a pulse. And they wait as short a time as 75 seconds, and that's the signal to cut out the beating heart to give it to someone else. The Revised Uniform Anatomical Gift Act makes it that it is presumed that everyone intends to donate their organs. In this act, there's a presumed consent for measures necessary to ensure suitability. These measures are done to living patients. It's no longer a requirement that you be of sound mind to state that you wish to give your organs. Sound mind has been stricken from the law. It seems to me that this makes everyone who has any kind of difficulty, mental difficulty, is in much greater jeopardy now. So far as informed consent is concerned, the Uniform Anatomical Gift Act allows everyone to move much more quickly without full and explicit informed consent. Furthermore, even if you have an advance directive, a living will that says you do not want to be resuscitated, you will be resuscitated until it's determined if your organs are suitable for transplantation. The Uniform Anatomical Gift Act in 1969 stated that these procedures would start after death. With the Revised Act, these procedures can start near death. Remember that near death is still living. The Revised Uniform Anatomical Gift Act spells out that any communication in any manner can be interpreted as an intention to give your organs. Furthermore, even if there is a revocation of whatever you have stated in the past, this does not invalidate your ability to be an organ donor. A revocation is not considered a refusal for organ donation. The Revised Uniform Anatomical Gift Act lowers the age of consent. It goes to 16 or 15 and a half, and in some states, even 14-year-old children can donate their organs. The criteria went from brain death to heart death, and how did it do this? The 1968 Harvard criteria required 24 hours of this comatose condition before they could declare them brain dead. They shortened the time from 24 hours to 12 hours, and then 6 hours, and then 3 hours, and then 1 hour. And there's one article in the literature that calls for an absence of breathing without a ventilator of 30 to 60 seconds. This then becomes the signal to start the procedures to cut out the organs. Between 68 and 78, there were 30 sets of criteria, and now there are many more. The Uniform Determination of Death Act made it that you could be declared dead either based on irreversible cessation of circulation and respiration or irreversible cessation of all the functions of the entire brain, or it could be both. So that you see, in the law, there are at least 3 ways to be dead, and if there are more than 30 sets of criteria that had been published at that time, there were 33 different ways to be dead. Let me tell you, there is only one way that you can be dead. Donation after cardiac death has been literally invented in order to get organs. What occurs is they get a do not resuscitate order from the relatives. Then the patient is taken off life support and observed for an absence of the pulse, not an absence of a heartbeat. The absence of the pulse was in the beginning for 10 minutes, and then 5 minutes, and then 2 minutes, and most recent article, August the 14th, August the 14th, 2008, in the Journal of the American Medical Association. Correction again. It's August the 14th, 2008, in the New England Journal of Medicine. Now, the living person with injury to his or her brain is a patient of a physician. It's only a living person who can be a patient. When he or she is a patient, he is living. After death, no longer does the physician have a patient. The remains then belong to the undertaker or someone like that. The person with an injury to his brain has a relationship with the physician that's based on the standard of intrinsic worth. The physician can protect and preserve life and postpone death. The physician must not kill, must not do harm, and must not hasten death. A person is alive until dead. An unconscious person in the intensive care unit on a ventilator with absence of some tested brain functioning but many other signs of life is living. The physician can preserve and protect the life. Brain death was devised to get organs. Brain death was devised specifically to get beating hearts for transplantation. Now, there are responses and movements that have been observed in patients who have been declared brain dead. These include jerks of the limbs. They include muscle tone, arms crossing over the chest and the patient sitting up. When the surgical incisions are made to get the organs, if they do that without paralysis and without anesthesia, there's moving and squirming and grimacing. Brain dead patients are given paralysis without anesthesia to take away the protests and objections of the medical personnel about a brain dead person not being truly dead. The brain dead patient, the ventilator moves air. There is exchange of oxygen and carbon dioxide that occurs in the lungs and via the circulation, the heart, and the blood vessels to all the tissues and cells of the body. There are many organs and systems that are intact, including the liver and the kidneys. Sometimes a mother will be declared brain dead. Because of being a mother, the treatment is continued. Days, weeks, and months later, there's a delivery of a normal, healthy baby. Prolactin is produced. This is the hormone that results in breast milk being produced. It's only a living mother who can support the life of a baby within the womb. If you compare living persons with brain dead patients and the remains of someone who's truly dead, the living persons and the brain dead patients have a beating heart. There's good circulation. The person is warm. Ventilation can result in respiration. There is growth of the whole body, growth of the hair. Healing occurs. And if you cool the body, if you cool the person, this slows metabolism. Yes, it is cooling the body, but sometimes in newborn infants, we just cool just the head. These things, cooling slows the metabolism. If you compare the living person, the brain dead person, with someone who is truly dead, someone who is truly dead does not have a heartbeat, there's no perfusion, the body gets cold, there's no respiration. You can attach a ventilator, but there won't be respiration. There'll be expansion of the chest, movement of the air, but there will not be respiration in someone who is truly dead. There is no growth of after death. There's no growth of hair. This misconception has been propagated by many, but there is no growth of hair. What happens after true death is the body gets dehydrated and shrinks, and that gives the appearance of the nails elongating or hair elongating, but there is no growth after true death. Cooling now slows disintegration. So it is the same cooling, but it has a different action. So cooling of the body, cooling of the person while alive can slow metabolism and actually protects the organs and tissues as the person can then recover. On the other hand, cooling, which is done by by the undertaker and the morgue slows disintegration. But once someone goes from being alive to being dead, there is disintegration and dissolution, destruction, and it is continuous. It can be slowed, but it cannot be stopped. One of the tests that's done as part of the declaration of brain death is known as an apnea test. It's part of every set of criteria. The patient is on a ventilator. The ventilator is going at a rate of, say, 20 times a minute, not unlike the way you and I are now breathing. What happens then is the ventilator is stopped, not for a few seconds or even a few minutes, but it's stopped for up to 10 minutes. What happens during this time is the carbon dioxide goes up. When the carbon dioxide goes up, this causes the brain to swell. So the apnea test actually causes the patient to get worse. The apnea test is done for the patient to prove that he can breathe without a ventilator. If the patient cannot prove that he can breathe without a ventilator, this is the signal to cut out his beating heart. Can you imagine someone with a severe head injury then being said that you must prove that you can breathe on your own or you will have your beating heart cut out? To do an apnea test is not unlike and is not is unreasonable in a manner that would be as unreasonable to do a stress test shortly after a heart attack. An apnea test should not be done on the patient with a recent head injury. Likewise, a stress test ought not be done immediately after a heart attack. The apnea test in itself can cause further damage to an already compromised brain. The apnea test is not a predictor of death, but it's a lethal test. The relatives must know to instruct no, no, no to the apnea test. The apnea test is of no benefit to the patient. During the apnea test, the complications that have been reported include a severe drop in blood pressure, cardiac arrhythmias and dysrhythmias, and even true death. Studies from Japan and from Germany show that without an apnea test, 60% made recovery. Thus, without an apnea test, 60 to 70% of patients might recover. The term performed in an ethically acceptable manner has been used. This refers to the natural moral law, that is, how do we treat each other. The natural moral law can be summarized as good ought to be done, evil must be avoided. The second part of it is evil may not be done, that good might come from it. You see how this fits in terms of what's going on. There's an attempt to justify the cutting out a beating heart because it can help someone else. On the other hand, the cutting out of the beating heart always causes the death of the donor. Ethically acceptable cannot include causing death or debilitating mutilation. Debilitating mutilation would include weakening or decreased function of the whole person or of an organ. Organ transplantation to be ethically acceptable could not include moving, grimacing, and squirming, and if you have to paralyze the patient so you don't observe these, this also is not ethically acceptable. And even when they paralyze the patient but without an anesthetic, when they cut on them, there's an increase in the heart rate and blood pressure. This reaction is similar to what the anesthesiologist sees during an operation if the anesthetic is too light. The consent ought to be in a free and conscientious manner. The consent or the decline ought to be after full and explicit information is provided. Everyone that must be properly informed. That is, everyone must have full and explicit information before any decision about consent or decline of being an organ donor is done. Organ donation results in the legal killing of vulnerable persons. Donors must be living to supply a healthy, vital organ, but legally, healthy, vital organs can be removed. In the process, this causes the death of the donor. Remember, the patient is living until true death. HIPAA and the Uniform Anatomical Gift Acts result in the records being sent to the Organ Procurement Organization when death is imminent. The Organ Procurement Organization then determines suitability for transplantation. The Uniform Anatomical Gift Act has language in it that says measures necessary to ensure suitability of the part. The part is used to label an organ or tissue, but measures can be whatever measures are necessary to ensure suitability of the part can be done as a result of the revised Uniform Anatomical Gift Act. The Organ Procurement Organization can conduct any reasonable examination to ensure suitability of a part. This is written into the law. The Uniform Determination of Death Act is the law that is in most of the 50 states so far as the declaration of death is concerned. This law is done in accord with accepted medical standards. This law was the first statute that included a standard of accepted medical standards. If you just think about whether their brainwave testing, brainwave recording should be done before a declaration of brain death, it would be customary to do that. It would be reasonable to do that. It would be ordinary to do that. Yet it's accepted medical standard not to do brainwave testing before the patient is declared brain dead. Death is whatever and whenever a doctor says it is, in accord with accepted medical standards. The Uniform Anatomical Gift Act, revised in 2006, makes it such that everyone is intended to be an organ donor, and it's presumed consent to do whatever the Organ Procurement Organization determines necessary to preserve the organs. The moral issues include, is this person in fact dead? Yes, from biology, theology, philosophy, and the law, we can get guidance, and it does help us. But on the other hand, it's an intertwining of all of these: biology, theology, philosophy, and the law. And while they can be separated, they all come together when it comes to the life of the person. May a test be done that could cause the condition to get worse? For example, an apnea test. No, you can't take the patient off the ventilator and make him prove that he can breathe on his own. That would not be something that should be done. When you take them off for up to 10 minutes, that causes the brain swelling to get worse. The patient can only get worse with the apnea test, so this test ought not be done. Are the donors truly dead before the healthy heart and other organs are excised? No. The person is still living when a healthy heart is cut out. What's the effect of organ transplantation and this more lenient standard of death called brain death? It's the culture of death that we find ourselves. And I would ask you, who protects the defenseless comatose patient? It's only you and me, because already at least 36 states have the Uniform Anatomical Gift Act, which takes away some of the protection that existed before that. In conclusion, then, to say someone with a beating heart, normal blood pressure, normal color, and normal temperature is truly dead is false. A person is living and not dead even an instant before death. The donation must not impose death or weaken the donor. Everyone must be fully and explicitly informed about organ transplantation. The test to declare death must not hasten or cause death. A person is living until true death. The only protection is to document refusal. When there is still doubt about death, excision of an unpaired vital organ is prohibited. To devise a fiction for the declaration of death is not ethically acceptable and is morally wrong. To cut out an unpaired vital organ, for example a heart or a whole liver, before death does not respect the dignity and value of the human person. The donor must be truly dead with certainty before organs are excised. And of course, at that time, organs are not suitable for transplantation, only tissues. Cessation of brain function laws are followed by living will laws, and they're all a part of or lead to imposed death. The Greek word for that is epivoeuthanasia. We're used to the word euthanasia, but in Greek, eu means good and thanasia means death, so a better word would be epivoeuthanasia. This can be translated in the English as imposed death, or if we use imposed death, it can be translated into the Greek as epivoeuthanasia. Death ought not be declared unless the circulatory and respiratory systems and the entire brain have been destroyed. The statute that is recommended states no one shall be declared dead unless the respiratory and the circulatory systems and the entire brain have been destroyed. Such destruction shall be determined in accord with universally accepted medical standards. You see how the standard is universally accepted medical standards. This is solidly based medically, ethically, and religiously and unexceptionable. The recommended standard for this is no one shall be declared dead unless there is irremediable cessation of respiration, heartbeat, and circulation. Irremediable means that it's not known how to do it. That is a much more correct and precise word. The determination has to be in accord with universally accepted medical standards, not simply accepted standards. These points are solidly based medically, ethically, and religiously, and unexceptionable. At the World Day of the Sick, in 2003, Pope John Paul instructed, "It remains a fundamental precept that life is to be protected and defended from its conception to its natural end. Every transplant must take into account it is never licit to kill one human being in order to save another." Medical card that I would encourage you to carry with you states this, that I wish to live the lifespan given to me by God. I direct my treatments and care, including nutrition and hydration, however administered, be given to protect and preserve my life. Do not hasten my death. Do not do an apnea test. Do not take any vital organ for transplantation or any other purpose. Thank you very much for paying attention. If you have questions, you can email them to me at pab@thelifeguardian.org. Thank you very much.